Life expectancy has slowly gotten longer over the course of human history. This is because of improvements in medicine. Because of advances in science and medicine, people's life expectancies have grown much more quickly in the last 100 to 150 years. In the United States, the average life expectancy in 1900 was 49 years, and it was the same in 1800. This huge change has been made possible by how much we know about medicine, disabilities, and science in general. Let's look at 10 medical advances that have made people live longer. However, before we start our countdown, we would appreciate it if you would subscribe to our YouTube channel and also press the bell icon. Let's get started. 10. The discovery of germ theory. We learn about germs when we are very young. Students are often told to wash their hands at school. In the middle of the 1800s, however, this was far from true. Instead, most people thought that disease came from something called spontaneous generation, which is exactly what it sounds like, disease coming out of nowhere. In 1861, French microbiologist Louis Pasteur, who invented the process of pasteurization, showed the scientific community and the rest of the world that disease was not caused by spontaneous generation. Instead, it was caused by microscopic organisms, also called germs or pathogens. The medical and scientific communities eventually agreed with this theory, which prevented thousands of deaths from infectious diseases like typhoid fever, the flu, and smallpox. The good things that have happened are endless. Understanding how diseases start and spread has been a crucial part of medical and scientific progress, and it has also made people live longer. 9. Anesthetics. Surgery is common in today's world. It is not unusual for a person to have 3 or more surgeries over the course of their life. Just 150 years ago, nobody would have ever done this. In recent years, there have been many improvements in surgical science, but none have been as important as the use of anesthesia. Before anesthesia was commonly used, it was not uncommon for people to choose death over emergency surgery. After all, doctors only did surgery when they had nothing else to try. Without anesthetics, surgery must have been a very scary thing to think about, especially since patients only had opium, alcohol, or a leather strap to bite on. And, of course, the surgeries didn't always work. William G. Morton was the first person known to use an anesthetic during surgery in 1846. He used sulfuric ether on a man with a tumor in his neck. Early on, though, using anesthetics was a bit risky and hard to predict. 8. Artificial intelligence in medicine. The next thing on our list did not happen so long ago. It sounds more like it came from the future. AI is a technology that has a lot of potential in all areas of science, including the medical field. AI technology is sometimes called machine learning, which means that software can organize information better than a person. There are many ways that AI could be used in medicine. AI systems are used in many ways right now, including diagnosing patients, communicating between doctors and patients, keeping track of medical records and prescriptions, treating patients remotely, and more. AI has already saved many lives and made medical processes more efficient, but it has even more potential for the future. AI can screen for diseases, tailor treatment to each patient, and even change genes. It's exciting to think about how much medicine and science could improve if they used artificial intelligence technology more. 7. Laparoscopic surgery. Before anesthetics got better, surgery happened much less often, as we've already said. Laparoscopic surgery, which came after more than 100 years, was another big step forward in surgery. In this type of surgery, the cut is smaller than in regular surgery. The surgery can then be done with less risk by using small tubes and even smaller cameras. Laparoscopic surgery was first developed in the 1980s. For obvious reasons, it is sometimes called minimally invasive surgery. Among the many benefits are a shorter time to get better and stay in the hospital. There are fewer problems. Smaller scars. The person will feel less pain. 6. Organ transplants. Organ failure has been a common cause of death since the beginning of time. Because of this, scientists have tried to do organ transplants for a long time. Doctors David Hume and Joseph Murray transplanted a kidney in 1954. This was the first time an organ transplant worked. This was a big step forward for medicine, and it has only gotten better since then. In 1963, less than 10 years later, the first lung transplant worked. In 1966, a pancreas was transplanted not long after that. The following year, liver and heart transplants worked well. These procedures are now done hundreds of times a year, making them much more common. One of the most important medical advances that has made people live longer is the technology for transplanting organs. 5. Antibiotics. In 2010, the Royal College of Physicians of Edinburgh was asked to vote on the most important medical advances of the last 50 years. What did they think is the most important change? In 1928, one of the best accidents that ever happened. Alexander Fleming, a scientist from Scotland, found a mold by accident in a petri dish. This turned out to be penicillin, the first antibiotic in the world. Antibiotics kept getting better and better throughout the 1940s, even though people didn't start using penicillin right away. Scientists Howard Florey and Ernst Chain started making penicillin in large quantities during World War II. Antibiotics have saved and even lengthened the lives of many people, thanks to the work of many other doctors and scientists. How could you disagree with the Royal College of Physicians of Edinburgh? Antibiotics have been a huge step forward in medicine. 4. ACE inhibitors. The next thing on our list is a treatment that is important but not very well known. Different things are done with ACE, angiotensin-converting enzyme, inhibitors. They are usually given to people who have high blood pressure, heart problems, or kidney disease. In simple terms, ACEs make the blood vessels of the patient bigger. This makes it possible for your heart to pump more blood. ACE inhibitors are often given to people with high blood pressure because they can help lower it. But they are also given to people with heart failure, diabetes, heart attacks, or who are at risk of having a heart attack or stroke. Millions of people in the United States are given ACE inhibitors every year. This medical breakthrough not only protects patients from organ failure, but it has also greatly improved the quality of life for many patients since it was first used in 1975. 3. Kidney dialysis. Kidney dialysis is a medical procedure that removes waste and extra fluid from a patient's blood when their kidneys aren't working properly. A dialysis machine is used most of the time. The dialysis machine cleans the patient's blood, which is then put back into the body. In other words, it's like the person is using a fake kidney from the outside. Even though dialysis is not perfect or comfortable, it has helped save many lives. Dialysis is often used as a way to put things off. It lets people keep living even though they don't have a working kidney. During this time, the patient is helped to find a good organ donor. The first dialysis machine was made by Dr. Willem Johan Koff in the Netherlands during World War II, when the country was occupied by the Nazis. He made the machine out of spare parts, like soda cans and parts from a washing machine, to help his patients. 2. Medical imaging technologies, MRI, X-ray Connecticut, ultrasound. The next big step forward has helped make possible CT scans, MRIs, X-rays, and ultrasounds. It sounds easy, but doctors couldn't see many parts of the body for hundreds of years. All of this changed when a German physicist named Wilhelm Conrad Röntgen made the first X-ray in the late 1800s. Shortly after that, the first radiology department ever opened in a hospital in Glasgow. The next big change in medical imaging didn't happen until the 1950s and 1960s, when doctors started using ultrasound and CT scans more. Paul Lauterbur made the MRI in 1973. Most of the time, the MRI is one of the first tools doctors use to make a correct diagnosis. 1. Vaccine. The vaccine is probably the best way for people to protect themselves from getting sick. In the late 1800s, the first vaccines were made. Like many other great technological advances, it was made because of a need. The smallpox virus spread all over the world and killed and infected many people. Edward Jenner was the first person to fight this disease by giving people shots. Through the use of vaccines, smallpox was eventually wiped out. In the 1800s and 1900s, there were also important shots for rabies, tuberculosis, cholera, polio, and more. Vaccines have been made with the help of new technology because they had to be. New vaccines are now being made quickly, thanks to mRNA technology. Vaccines are an important part of our society, and they have saved millions of lives by keeping people from getting sick. So, that's it for today. We hope you enjoyed the video. Use the comments section below to tell us what you think about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.